Welcome to this week's episode of Promising Young Surgeon. Today, we have an incredibly important topic to discuss: women's health. Joining us is an expert in the field, Dr. Franziska Haydanek, a board-certified Ob-Gyn who's dedicated her career to advancing women's health and making this vital information accessible to everyone. Not only does Dr. Fran work tirelessly to improve patient care, but she also excels at educating the public on these topics and ensuring that people have the knowledge they need to make informed decisions about their health. What's more important than that? We will also be diving into another topic, close to both of our hearts, which is collaboration in medicine, and whether that's working alongside doulas and midwives in the world of obstetrics, or in my experience as an ENT, working closely with audiologists and speech-language pathologists, for instance. This team-based approach in healthcare is key to providing the best possible care for our patients. Dr. Franziska Haydanek, also known as Dr. Fran, is a board-certified Ob-Gyn with more than 7 years of experience, and she currently practices at the Rochester General Hospital in Western New York. Besides treating patients, Dr. Fran also provides education about obstetrics and gynecology online via TikTok and Instagram to combat misinformation on social media, and also to empower her audiences with fact-based knowledge about their healthcare. So, Dr. Fran, thank you so much for being here. I'd love to just start with your journey into women's health. What inspired you to go into Ob-Gyn?
I've always had a lot of interest in reproductive health. I remember taking a class in college just about women's reproductive system. I just found it so interesting. So when I finally found my way to deciding that I wanted to go into medicine, I always thought that I would probably go into obstetrics and gynecology. I kind of took a couple turns throughout medical school. I thought for a while I might be a pathologist. Turns out the science is very interesting, but the job isn't for me. But after my first OBGYN rotation and really the first delivery that I saw, I knew that I had to do this. I just loved all aspects of obstetrics and gynecology, both the pregnancy part, but also the continuity of care that we have with our patients lifelong, from really, their pre-reproductive years through reproduction, and obviously the many years that follow. And I just found so many aspects of it so interesting and just really felt drawn to it.
That's incredible. It is great when people really know what they want, although that is an interesting split. I'm not sure I've met another doctor yet who kind of felt drawn to pathology in some ways and then OB in the majority of ways. That's cool.
They're very, very different, obviously. I just love that pathologists were experts of all diseases in a different way than most other doctors are not. When I did my rotation, I just realized I did miss the patient interaction. So I let that part of my interest go and really focused on the part where I really get to be involved with patients daily.
That's so cool. And that's a good point, though, actually. I would imagine radiologists obviously also get to experience that as well, where, they stay with every body system.
Exactly.
In my experience, I do joke that I tell patients sometimes, I'm only clavicles up. I don't know. And I mean, now the rest of the body is a little bit of a black box, but that's what happens when we super specialize.
That's so interesting because I'm clavicles down.
Oh my gosh. And I guess knees up though, clavicles to knees or something like that.
Yeah.
Yeah. We all have our own kind of path ahead of us. That's great.
Exactly. Yeah.
How has your passion for educating the public evolved throughout your career? In the early days, in medical school, as you're going through this decision-making process, was this on your mind?
No, not at all. I was going through medical school in the early 2010s, so the internet was a little different then. I was on the internet during that time. I had a style blog where I showed what I was wearing to medical school. I had started it prior to medical school, actually. So I was always kind of on the internet in some ways. And then as I was in medical school, I would talk about interesting medical things that I learned, but more as just a sidebar to what I was talking about on my blog. And then when I got to residency, my program really asked me to not really talk about medicine online. And I think that was fair as a trainee. But then when I graduated was really the time that TikTok was really starting to pick up. And I just saw so much misinformation on the internet about topics that, we are so well versed in. And so I really saw it kind of like I'm already was used to being on the internet in some ways. And how can I be a voice of almost like reason and, medical expertise and what is a very like volatile internet situation. And so, no, this was never like my intention. I've always enjoyed teaching throughout like parts of my life. I really enjoyed teaching medical students when I was a resident. So that part does come somewhat naturally to me. It's also why I chose to be faculty at a residency program for my current job. So that part comes naturally to me, but it was never my intention to, come to the internet to be that voice.
That's so cool though, because it does make sense. And I know that, when you and I have talked before, like there is this air of true comfort and also authority that I think you bring to your content. And that makes perfect sense though, because now I'm learning that you did have a lot of actually history and skill building in this world from your fashion blog, even back in medical school, which that makes perfect sense. It kind of primed you, and then you were ready to take on like a very big task, like kind of a daunting one for many of us as physicians, which is kind of like grapple with education of the general public about your expert medical knowledge.
Yeah. I always say, we already are taught how to communicate medically, right? That's what our medical training does. And then in our day-to-day, we really learn how to communicate that in simple terms with our patients. That's a lot. That's the hard part about speaking with patients, is trying to make it understandable. So I feel we've been training for this for our entire careers to be at that point. But, I can only see like 25 patients a day, and I assume your numbers are similar. So we can't reach as much as we could on the internet, right? I can only talk to 25 people in one day at my job, but I can reach, almost 1 million people now through the platform that I have. And I think there's a lot to be said about doctors being on social media and being the voice of reasons and being the voice of expertise that sometimes is very much lacking on social media.
Do you see any common pitfalls that doctors should try to be mindful of avoiding as they start to make that transition?
I think it's very easy to get to have an air of like, I know better than you because I'm a doctor, right? And I get like a little, sassy with it sometimes, because there are times where people give medical advice who like should not be giving medical advice. And I do, get a little sassy with that because I think it's inappropriate. But I do think, we want to be a voice that people trust. And so kind of sometimes removing yourself from that situation, not getting too sassy about it or too like, I'm better because I have the training. I think there's a lot of people, like you were saying, on your side in ENT, where you have other people who are very well versed in different parts of a similar system. And same for me, right? I have doulas and birth workers and midwives, and there's lots of people who work within the pregnancy and childbirth space, and many of them are very, very knowledgeable and smart and know things that I don't know. And so I think you have to keep in mind that you just don't know everything, that you are an expert in one part, but you may not be the expert in all the parts, and coming at it from a place of wanting to educate and not alienate.
I love that. And I fully agree with you. I mean, I kind of think that doing everything, not just even how people approach maybe like online presence, but doing everything with less of an ego first approach to, a seat at the table. I think that's great. And that makes sense though, because it does ultimately make physicians or make creators both more relatable, more likable, right? Like I don't know of anyone who's like, yeah, I'm following this like egotistical maniac. Actually, I mean, I guess some people like that. And certainly, on Reddit, people talk about egotistical maniacs, but it's like, that's not really the space we want to occupy. That's not what we're talking about today. So your advice really makes sense.
Yeah. I mean, I really think of it as you want to be like your friendly neighborhood gynecologist, just talking about periods or talking about things in ENT, but it just, you want to be approachable, and sometimes you have to like take a step back and watch it. And for me, I have to remind myself, like, I have almost 1 million followers across my social media. So there are so many eyes on me, and I have to see it from the eyes of my patients. I have to see it from the eyes of my boss. I have to see it from the eyes of the lay public who may not like me and may be looking for me to make a misstep. And so I kind of think I don't want people to find that like daunting, but I do find it helpful to like think like everyone is going to see this, and how would someone else perceive what I'm saying?
What's interesting is, so one part of my life I'm really passionate about, I am a writer. And in one of my writers roundtables here, like one of the biggest lessons that we have just as kind of part of the whole journey of bringing your book to life. Like, of course, yeah, there's the vomit draft, then there's like 2 through 40 additional drafts. But here's step 3, like phase 3. Because like I said, phase 1 is going to be get your first draft of the book out. That's the vomit draft. Phase 2 can be like 40 or more iterations, but that's like get your draft to where you really want it to be. And here's phase 3, hater proof your draft. You need to hater proof the whole manuscript. That's the last phase that happens kind of before going to publication. And it's just funny because I'm reminded of that when you talk about this, because it's like you hater proof your content.
Oh, yeah. I mean, so, it's not that I haven't made missteps and people haven't misunderstood what I was trying to say. And I acknowledge that. But yeah, you do have to like hater proof it, right? You have to like, is someone going to twist what I'm saying, or are they not? And so I think that's a great way to look at it. And creating content is, short form of writing a book. I have not written a book yet, but I can imagine that's a very similar process. And so similar to your 40 different iterations, many of my videos I have recorded several times before you see the final product. So, it may look polished, but most videos I had to do a couple times until I could really figure out how can I succinctly say what I'm trying to say, get it all across, make it interesting enough to watch, and put it out there. So it looks a little shinier than the actual process is.
Do you always do those like typically in one sitting, like kind of at least batch record those? Or does that mean that sometimes you say, okay, I've done a couple runs of this, I'm going to walk away. Like I'll come back to this video tomorrow.
Oh yeah. There's videos where I'm like, I know I'm not saying this the way I want to say it, and it's going to come across negatively when that's not what I mean. And I just have to like walk away. And sometimes I'll come back to it. And sometimes I'll say like, I know that I can't say this the way that I intend, and I just let that one go. Like, wow, is this going to be
that's very wise.
Worse? Is this going to help, or is this going to make people misunderstand my intent? And if I can't make it clear, then I have to let that go.
That's incredible. But that, like, again, that's just that almost sounds like pretty meditative, and that's like a level of wisdom that I don't know that all of us have access to, I guess. Like we're trying to still work that out in our regular lives, right? Like, can I add to this discourse in a productive way? Yes or no? If no, no worries at all. I'll walk away.
Absolutely. Like you said, I think there's a lot of similarities. And I said that I haven't written a book yet. I've been approached about it. And I have said, like, I have to write a book about something that I feel I'm adding to the conversation, right? I have to write something that is new and insightful and something that I would want to read. And if it's not that, then I don't want to write it. And the same with the video. If I don't want to watch this video, then why am I even bothering making it?
That's a great way of looking at it. In terms of your prep process, does it involve kind of scripting out like major points beforehand? Is it just, okay, I'm going to launch into my first recording and going from there?
For the most part, if I'm covering like true medical things, like for example, today I made a video talking about anemia. I did want to have a couple like up-to-date shots to like really have a reference to. So those I like kind of prepare for. A lot of the times it's more off the cuff. And those ones I don't. Like I never write a script. I generally have thought about what I want to say, and that's where the re-recording comes in, is where I'll watch it back and be like, nah, that's not how I want to say that. Let's try it again. But yeah, I generally don't do a lot of pre-prepping.
Okay. And that probably makes it easier to come across, much more naturally in the way that you just like very conversationally naturally come across. So that's cool.
Yeah.
How has the field of women's health evolved since you started practicing and also started bringing this content to the general public?
That is a great question. I think that patients are really, because there's such an access to like education now through the internet, I think a lot of people are really finding ways to educate themselves throughout, for me, example, like a lot of pregnancy discussions and a lot of any like disorders of menstruation or PCOS or endometriosis. There's a lot of people making content around it. And I think it's helping people realize like, oh, I might have this, or this is the kind of birth that I am interested in. And so that has really changed even in the time that I've been practicing, or since like starting residency, especially, that there's just so much more information now available. And so patients really come in kind of like prepared to talk about the things, or they know what they want. You know, when I talk to patients about the end of their pregnancies and how they want their deliveries to go, and do you want to be induced or do you want to wait for spontaneous labor? A lot of my patients like know what they want. They've already like looked into it. They've watched videos and they say, this is what I'm interested in. And so I think in that way, people are really gaining access to information that they didn't have previously.
Yeah, that's a great point. I mean, I'm sure just even a decade and a half ago, people were not coming in with these fully formed plans the way that they can today. And it is interesting because I would say that might be something pretty unique about the work that you do, because I will tell you, you know, I see a lot of head and neck cancer, for instance. That is not extremely straightforward. That can be a really hard topic, like especially at the time of initial diagnosis, which is where I typically, you know, see my patients. You know, we're still doing workup and staging and things like that. And it's hard. I mean, you know, staging is hard for every subsite. So just like if you have tonsil cancer, a new diagnosis of, let's say, HPV positive tonsil cancer, it's still going to be hard to find very personal, applicable, direct information for you. The way that I think that women are now empowered to come up with their own birth plan. Like that is something, even just from a medical standpoint, though, that's something that I think lends itself to kind of publicizing.
Right. I mean, even think about like the fact that you and I are sitting here today, right? We're younger women who are on the internet. We grew up with the internet. And so, and at least with pregnancy, half of the population is going to go through it. So now we have young women who grew up on the internet who are experiencing something that the majority of other women are. And so it makes sense that pregnancy is a big talking point on the internet. There's probably not as many 50-year-old men talking about HPV cancer on the internet because they're not on the internet, and like who's making it, then there's not as many of them having it. And so that's definitely why I think especially women's health is such a big talking point on the internet, is because really of the populations who experience it and who is actively making content on the internet. I think like 70 to 80% of content creators are women. So
that totally makes sense. And consuming, you know, creating, consuming. But that totally makes sense. You know, I think that in the ENT world, probably facial plastics, you know, mirrors what you're talking about. And certainly I see that. Like, of course, I'm fed a lot of, you know, facial plastics, Botox, filler.
Yeah. My God, I love the videos where they talk about like what filler like people got and how they like, you know, optimize their facial symmetry. I love those videos. So of course, like that's what's going to continue to be getting views in that topic of medicine.
Totally. Well, and oh, by the way, I want to go back and just call out, all I heard 1 minute ago was that you said I'm a young woman. So like, you know, that I don't get that every day. So yes, exactly. Like I'm with it. I'm online. You guys heard it here. Like no one bother me about like all my gray hairs and the aging process and
don't
stuff.
Don't tell me I'm wearing the wrong kind of pants. Okay. I'm still young.
Oh yeah. Or the wrong kind of sock. I honestly, I bought some higher socks. I was like, this cannot be the thing. Like I'm terrified of teenagers. I'm like, I cannot be walking down the street.
Middle part now. Like I'm with it.
I love it. I love it. Well, I would love to hear about some of just, and this is a big question because you've been creating for a long time, but just some of the most common misconceptions that you're seeing maybe like now, maybe this year in this conversation about women's health and online materials.
Yeah. Obviously, the election is driving a lot of discussion around women's health, right? And abortion care and what type of abortions there are and what is being provided. So, obviously, there's a lot of misunderstanding, even by candidates, being shared about what exists within women's health. Of course, the topic of birth control is always an option. I think the field of gynecology hasn't done the best job at explaining why sometimes we use hormonal medication to treat hormonal disorders and have really not always done the best by looking for a reason, right? And I think people are really starting to rebel against that and be upset that, like, you never found the reason for my abnormal bleeding. You just gave me this solution. But that gets complicated in the discussion of actual birth control access and who can get it and what certain politicians are trying to do with birth control. So it's a very complicated social and political discussion that happens. I really think that outside of probably infectious disease and COVID in the last 5 years, there aren't many other subjects in medicine that have as much political involvement, as much scrutiny from the general public.
That's very interesting. I will say that I agree with you. Like, first off, I totally agree. And if I had to think of maybe something that I could compare my own practice to, that is actually HPV tonsil cancers.
Yes.
Because at the end of the day, I do try to do a good amount of like education about vaccines, Gardasil, and vaccines innately, they fall into that bucket of kind of like politically charged medical content. So sometimes we have those conversations nowhere near, I'm sure, at the frequency that you do. But when I think about these, so we'll just call them maybe like hot button topics in that bucket. What do you think as a physician for your patients, but also as a creator approaching all your medical education online, what's the best way to approach that conversation that's saying, I'm going to give you evidence-based medical information. I'm going to give it to you as a physician. So I hope it's received with the intent that I'm giving it. And kind of leading from that place, as opposed to maybe getting in the weeds of like these political or emotional or cultural missteps.
Yeah.
Or we'll call them holes to step in.
I think, both in direct patient care and also online, it's our job to give patients the information, right? Give them the risks, the benefits, and then let them make their own decision. I can never have people make decisions that I don't agree with, right? Or that I personally would not make. But it's not my body at that point. And it's hard, right? Especially when I am seeing younger patients who are in the HPV vaccination age range. And I have the discussion that this isn't just about cervical cancer. This is about all the cancers that can be caused by HPV. And if I've given my heartfelt recommendations, it's like our job, it's our patient's job to decide what's right for them. And I cannot take on a decision that is different than the one I would make. And that's hard, I think, at times, because we have the data that supports our recommendations, but I can't take on when someone wants to do something different.
Totally. And I mean, in terms of like plugging, Gardasil and these vaccines, I have seen really serious cases of HPV positive tonsil squamous cell carcinomas. I have seen them in women and men in their 30s. Like, this is not, so I like the nuance to what you're talking about, because it is so true. Like, we want the best for our patients. Like, I care about all my patients and I absolutely want the best for them. But at the same time, you're on point, because if somebody makes a decision I don't agree with, I still don't take that personally. I mean,
Yeah.
Tobacco smoking cessation, that's another big one in my world. And it's just, I think totally with respect, I don't view that as a comment on me or my identity as a physician or surgeon. I do think that there's this line that we walk as doctors, which is like, as you said, I'm going to give you the most accurate, best info that I can, and I'll give it to you respectfully, and I'll respect your decision. So, I mean, I do tell people, I've told my patients, I say 100%, you're an adult and you can decide whatever you want. I've laid out 3 paths for you.
Yeah. I think it's very hard because we just want to keep our patients safe and we want them to like live long, healthy lives. And it's very hard to see someone making a decision that could really negatively impact them health-wise. But you just like can't take that home with you. Like, that's not your job. They're not like your young children. They're patients. And like you said, they're adults and they make their decisions. And if there are consequences, then those are also their decisions. And so I think it's very hard as doctors. And I think that's sometimes why doctors come across a little like patronizing, because we've seen the negative consequences and we just really don't want that to happen for people. But it's their bodies and they get to decide what's right for them.
How do you address sensitive topics like sexual health with your patients?
I try to keep it like a very open conversation, right? And kind of gauge where they are and if they even want to talk to me about it. Some patients are there to like get their pap smear and get out, right? And some people really want to have an open discussion about ways that I can help benefit parts of their lives that they don't know who else to talk to. And so, I try to keep it very neutral going in. Are you currently sexually active, male or female partners? Do you have any concerns, any pelvic pain? And if they're like, no, everything's great, like, they probably don't want to talk to me further. But I have a lot of patients who would, bring up concerns and we troubleshoot ideas of ways that we can help with that. I'm also very fortunate that I work in an area that has a lot of sexual health resources and doctors who specialize in it. And so I have other additional, backups when patients really have problems that I can't help with, but might want to have longer sessions to really dive deep into what their concerns are. So I am very fortunate that at least I have those resources, because I know not every OB/GYN has that.
That's wonderful. Yeah, I practice in a rural community hospital setting, and unfortunately, in terms of other subspecialists in the area who take all the insurances like we do, it can be really difficult. Like, there's definitely a shortage that we feel here. And just for instance, like some of my head and neck cancers, if it's an extreme case and the insurance is like just not the right one, like it won't be taken more locally, people will have to make this commute basically from, we are in a town that's south of Nashville. So Nashville's the big center, but they don't take all insurances. Nashville, actually, I see it in the news for like very high rates of privatized, healthcare. Mm-hmm. Anyway, I digress, because it's just tough. And I try not to take this home with me, but we have had head and neckers that we send to Memphis, which is UT Memphis. And that's a several hour drive. And so that does, I really envy kind of the resources and support network that you have, but that's great. And I feel like that can allow you as a physician to feel like extremely confident even going into those conversations with your patients. It's like they could probably not say anything that would stump you or your colleagues.
Yeah, I am fortunate that I work in a resource-rich community for the most part. The lack of access to appropriate care is one of the biggest downfalls about the American healthcare system, especially for the states. There's states that have only one GYN oncologist for the entire state. Like, I have like 7 in my city. And so I don't know how you fix that. We have such a wide geographical area to cover. And I do, we're going to see the future, and we continue to see the future of how telehealth and AI is going to contribute to treating some of that, right? But there's never going to be enough of us to provide all comprehensive care to shorter distances for people. On the obstetric side, maternal health deserts are a very real thing, right? There's people who have to drive 2 hours to their closest labor and delivery, and that is crazy. But that's part of the reimbursement problems. And I'm sure that's, like you were saying, very similar in oncology as well.
In your own personal experience, or like in some of your colleagues who you know about their careers and their journeys, have you guys been affected directly by like state by state legislation that of course does impact OB-GYN practice?
Yeah. So I'm very fortunate because I work in New York State. And so we are an incredibly liberal state, and we are very supportive, and we actually support a lot of the neighboring states because they are not as supportive. I was trained in Ohio, and Ohio is a lot different. And there are very few places that provide abortion care in Ohio, and not much different than I'm sure in many of the states around you. And so those have big downstream effects on a lot of parts of, pregnant patients, the patients that we're taking care of, and the access that they can receive.
Yeah, that absolutely makes sense. I appreciate, you sharing with us about that. How do you stay updated on the latest research and guidelines in women's health?
I think there's a misconception that like doctors graduate from residency and then never learn another thing. So obviously I do all the same things that everyone else does. I go to conferences, I read my journal articles, I do my continuing medical education. So that for us as OBGYNs, that includes reading like 14 articles and doing quizzes to make sure that you actually read it and understood it. And then because of a lot of social media stuff actually is I sign up for a lot of emails kind of giving me current updates. So like ACOG, which is our college, sends out lots of emails about what's going on in the field. So I read a lot of that and I kind of pay a little closer attention because I kind of see myself as like the gateway between those publications and like the lay public. So I use that as my opportunity to really stay up to date on current recommendations because I want to share them with, my followers.
Yeah, like breaking the news and distilling it down and disseminating.
Exactly.
That's awesome. And that's a really good tip, I think, for a lot of us. For me, certainly, I've not really thought of our ENT literature and like the newest journal articles that way.
Yeah.
But certainly
a lot of it is a little too esoteric for the general public, but there's big takeaways even with like novel research that the lay public wants to know about. You just have to be able to like filter it down to be able to talk about it so people understand.
Totally. And, it's so funny because I do think that examples of that in ENT, like I am always doing that for my patients.
Exactly.
For instance, last year, like explosive, new studies, research on like proton pump inhibitors, which a lot of people give out like candy for reflux. And so that's a good example. As you're saying, patients want that information like yesterday. I have a lot of patients who were put on them 10, 20 years ago and kept on them for years, and this study was looking at the effects after a couple years of continuous therapy, finding things like dementia, osteoporosis, C. diff infection risk. Like it's not a nothing medication to be on continuously for years. So, I appreciate it because it's like you talking about this for me. And I think other physicians who are listening, it's like, it kind of challenges us, I guess, to think bigger than even just patient education. Because honestly, that's a conversation I have fairly frequently in clinic.
Exactly. And so you're already taking that information and condensing it down to information that patients want to hear about anyway. So if you just want to make a quick, 70-second TikTok about it, now you've become, because the thing is that those studies get published and then the news just talks about it, but there's no doctor involved, right? And so it becomes headlines that spiral. We saw this recently with the tampons and the arsenic and all that in the tampons, right? It became this explosive thing until, a bunch of gynecologists, like my other friends on social media, had to come and be like, whoa, tampons aren't poisoning you. Let's actually look at what this said. And I think the general news can like make people spiral, and it's kind of like our job to come and be like, okay, let's step back and like, what does this actually mean? So in your case, there are probably people who should stop their PPIs and like reevaluate what they're treating and what might be a better option. For me, in like the tampon study, I would probably not recommend that people stop using tampons because of this singular study, and here's why. And that's again why I think that physicians really should be more on social media than we already are. I see that a lot more people are getting into this space, and I think that's wonderful, but we need to continue to be those like level-headed voices of reason for the public, especially because like you were saying, not everyone has access to the jobs that you or I do, but they want the information.
You're making a really good point about the void, like kind of what's missing. Because yes, we do have, high quality journal articles. We have like novel studies coming out all the time for us through our societies, through, JAMA and all of its million spinoffs. And we have the news, which, yes, like you're saying, I mean, of course, I do see the occasional in and out medical correspondent, things like that, which that's great. But it's like very few and far between, definitely not proportional to the amount of comments that are made in the news about directly medical topics. And so, yeah, that's awesome. I mean,
I think
You're
medical
right.
training teaches you to be nuanced when you're talking to your patients, right? And that can easily be translated into being nuanced on the internet. It's lacking.
Do you feel like the skill set that you learned going through medical school, going through residency then and all your training that prepared you for the patient interaction? Do you feel like that prepared you really well for the internet interaction? Which I still, I've told you I'm a little bit more afraid of the internet. So, I would like to know how translatable these skills are
Yeah.
and so forth.
I don't know how your training was, but in my training, every single day, I had to basically repeat an ACOG practice bulletin back to my seniors to really show that I understood the information. And so I find that no different than what I do on the internet when, someone tells me, oh, it's your fault if you got gestational diabetes. I'm like, no. The practice bulletin here from this study here says that it's actually not your fault. It's the placenta's fault and there's nothing you can do and blah, 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 blah. So I felt I had to practice for years in training to be able to succinctly talk about what the evidence and what the current recommendations are. And so I found that to be an easy way to go into that. And I only really talk about the things that I know about, right? I'm not talking about head cancer because that's not what I do. And so you're not going to be talking about pap smears because that's not what you do. You already practice talking about this in layman's speech all day long. You just have to do it in front of a camera.
Mm-hmm. Did you ever at any point in your journey doing this have fear of the camera, have to do more takes early on? Or, because I do think that at the end of the day, there are kind of natural skill sets amenable to the work that you do.
Not really. I just kind of kept going. I will say now I try to make it a little bit more polished. I try to make sure that my hair is done. Otherwise, before I was just kind of laying in bed at times talking, and I try not to do that as much anymore. But not really. It just, like I said, what you see in the finished product is you do not see me stumbling over my words 19 times. You didn't see me re-record it 3 times. And that part can be hard and frustrating because you feel like you want to get it out, but you can't figure out how you want to do it.
I appreciate you sharing that because it is a good reminder to all of us. Yeah, I'm in awe of your content and I'm like, wow, that's incredible. And some people just make it look really easy, but it's 10 years of perseverance and dedication and hard work will make you look like an overnight success.
Exactly.
Right?
It's you didn't see those 10 years of work. You just saw me pop up and easily talk about the subject. It's you didn't see me when I was a first year medical student learning how to say these words. You didn't see me as a resident have to relearn what ACOG says so I can repeat it. And you didn't see me make this video 4 times.
That's awesome. No, that's a good reminder. I think good for all of our mental health to hear that. And that's true of everyone that we idolize online, I suppose.
Yeah. I mean, there's so much work that goes on behind the scenes of all of this. And then we ingest the final product, right? Just like you are going to have to spend a lot of time putting all this together and making it look nice. None of us are going to see all that work that you did. But it's going to look really nice at the end.
I mean, I don't have to do any work because we're young. We look nice. No editing goes into this. Yeah, exactly. We're 100% with it. We come polished. No, I'm just kidding.
That's just who we are.
So I'd love to hear about any emerging trends or advancement in women's health that are really exciting to you, in this season, 2024, we're coming up on the fall, winter.
Yeah, I think we're seeing a lot of great innovation happening, especially and this will apply to you as well, but pap smears. So we're seeing a lot of at-home testing being available, self-swabbing being available, and so really increasing access to care and into cervical cancer screening, I think will be great because, again, people are in places where they're not going to be able to see a gynecologist for a pap smear. And so if they can just get a kit sent to their house to swab themselves and know that they're getting cancer screening, I think that's going to be a really great way to increase access to care.
That's awesome. I hadn't heard about those. Are those kits available to anyone online right now?
I think they I saw this in one of those emails that I get. I think they just are putting them onto shipping containers and stuff. They do this in other countries already. I think Australia has been doing this for a while, but in the United States, it's just being rolled out as we speak.
Will it need an order or a prescription?
So there's a couple different ones. There's ones that you have to do it in a healthcare facility, and there's ones I believe that you can order yourself. I think it's still how that exactly works is still being like sussed out a little bit.
Oh, that's cool. Because I mean, yeah, the future's here. Like that would be really revolutionary for women to be able to get an at-home kit, and especially if there wasn't like a barrier to obtaining that at-home kit. Cool.
And people tell me all the time that they hate coming to see me, which just warms my heart. I love that. So I think coming to the gynecologist can be scary, especially if there's any sort of history that prevents you from wanting to see a gynecologist. And so any of those things that can really bypass those barriers but still get you screening is nothing but a positive in my mind.
Totally. And can you share with us an example or a story from a time when your public education efforts made a significant impact, that came back around, and directly impacted you?
A lot of it is just people sharing on the internet with me that my content helped them make an informed decision about their own pregnancy. And that has been really nice. I think, I created a list of OBGYNs who are willing to sterilize younger child-free patients because there was kind of a lack of doctors doing that. And so I've, over the last 3 years, received hundreds of comments from people saying, thank you for helping me find a doctor who respected my choices. And then I got the surgery that I wanted. And I really feel I probably don't even fully comprehend the impact that list has made on people's lives. But the people who have shared with me how much it benefited them has been like very rewarding to me.
Oh, I'm sure. That's like incredibly, singular work that you're doing. How did you find the resources to make that list? Was that your own network or?
Yeah. So prior to the Dobbs decision being made officially, it was leaked, and I'm in a Facebook group of like 6,000 OBGYN moms. And someone had said, hey, who's willing to do these sterilizations for these patients, right? And so there was a list of like 400 or 500 doctors who I was like, I will. I live in Madison, Wisconsin. I live in Rochester, New York. I live in Nashville. And at the same time, I made a video, kind of around the same time, I made a video saying like, if you are looking to get sterilized, here's how you should do this. You should make this type of appointment. You should tell your doctor these things. You should understand that these are the risk benefits alternatives. And then I said at the end of the video, if you can't find a doctor, let me know and I'll like point you to some. And so I had like hundreds of comments of people saying, I'm looking for someone in San Diego. And so then I would go reference that Facebook group and like type in San Diego and then be like, oh, you should go see Jane Doe in San Diego. And finally I was like, this is not like a helpful resource, this like secret Facebook group. And so I said on the Facebook group, I was like, if you're willing to be on a public list, please submit yourself here. And so that's where the first 150 gynecologists came from. They self-submitted from this OBGYN moms group on Facebook. And then I posted the video, not super intentional, but the day that the Dobbs decision was made final.
Wow.
And so that video went very viral and quickly had many people emailing me, be like, my doctor did my sterilization, please add them. Or I'm an OBGYN, please add me. And so over the last 2.5 years, it's now grown to over 2,000 doctors. And so people use it daily and I see this, I get tagged a lot in videos on social media where someone's saying like, I just want to get my tubes tied. I don't want to have babies. No one's willing to do it. And someone will be like, Dr. Fran has a list. It's by state and by city and you can find a doctor. And so it just kind of came out of two kind of simultaneous situations. And I just saw the need of having that resource for people.
Yeah, that is incredible. That blows me away. And, I, like you said, I'm sure that it would not even be possible for even you to see the full impact of all the life-changing, sequela of that.
Yeah, I don't think I at times really can't comprehend the impact I have on people because it's kind of gotten beyond me, right? I know what it's like to talk to 25 people. I can imagine what it's like to talk to 200 people. I can't really comprehend talking to 1 million people, right? And reaching that amount of people. And so knowing the work that I've done and how it's impacting people in all parts of the United States and beyond, it's hard to really grasp that, and also be able to verbalize like the difference that I hope that it's made.
That's incredible. Yeah, what you're doing is absolutely incredible. I do want to shift to talking a little bit about just collaboration in medicine, because again, as I mentioned in our introduction, I'm very passionate about collaboration across different teams within medicine and surgery. And of course, in obstetrics, the team-based approach involving midwives, doulas, I'm sure even team members that I don't even know about that I need more education on. And so I'd just love to hear about your relationship with all the members of the team, how you work with those professionals to just ensure the best quality care and outcomes for your patients.
I will say that I felt I was not given a full scope of this as a trainee just because of where I trained. We did not have many doulas in our community. We did not have any certified nurse midwives who worked in my hospital. So I've really spent the last 3 years since I graduated from residency working in the environment I am, really having learned what the true benefits are of having such a great collaborative team. And so, certified nurse midwives are nurses who went on to receive masters in midwifery and get extensive training in low-risk pregnancy and do such an excellent job taking care of low-risk obstetrical patients and providing them that care. I am there purely as their backup. I'm not in charge of them. They are their own, obstetrical providers, and I'm just there to be help if they need me. And because I think we have such a great working relationship and we really enjoy each other outside of work as well, that we can easily work together taking care of our patients. And same with doulas. I'm very fortunate that I work in a community that has a very strong doula presence, and we have really tried to find ways that we can come together and really understand where both of us are coming from. We had a doula day at my hospital where on a Saturday we had a bunch of local doulas come in. We showed them how you can be in the operating room. These are the things we have available. How can we help you help all of our patients and come together? And I think once you know each other and work together often, that can only benefit the patients because we know each other's strengths, right? Like I know how my doulas are going to be able to help my patients, work through their labor and feel supported in all aspects. And they know that I'm coming from a place of like love and wanting to take care of them and keep everyone safe in the ways that I medically can. And when you come together as a care team rather than, and there's going to be disagreements and, with our nursing team who's there with our patients like minute to minute, taking care of them, having that trust between all the team members is how you're going to have the best care. And there's going to be times that we disagree. There's going to be a time where a doula doesn't agree with me. I don't agree with the nurse doesn't agree with the resident. The midwives want to do something different. But when you have a deeper relationship, it's easier to work through those, right? If you have just met and you're already coming from a place of disagreement, it may not be the best working relationship. But the more you work with each other, the more you're going to understand where the other is coming from, be willing to listen to each other, and really think about who are we all here to serve, and it's not me.
That's a really beautiful way to look at it. I would say that I totally agree, anytime two people meet, yeah, of course, that won't be as strong of a working relationship as when they kind of get to work together and know each other and things like that. But I do think that another part of it is that basic respect that you clearly have for those professions. Like one topic, just as an example, that we do talk about on Promising Young Surgeon, I talk a lot about it with respect to the hidden curriculum of medical training, is specialty disrespect, right? Some specialties, they're all different, and sometimes they will say disparaging things about other specialties. And that's like doctor on doctor crime. It's so unnecessary. It's and it's harmful. It's a lose situation, because what I think is so interesting too is that in one of the studies that came out of a med school within the past few years, not only does making a disparaging comment about another service, right? Make that service do it. Like just make them order that med, right? We don't order meds. It makes the med student witness not only, not want to go to the service, right, that you're disparaging, but also not your service. It's not a good look, right? No. So it's a lose. But I do think that this complex issue, it only amplifies as we look at like a lot of our other team members. I'm a huge believer in For instance, I have an audiologist. She works in my clinic with me. I'm obsessed with her. I have so much respect for her. She's been doing this 13 years. She's phenomenal at what she does. Agreed. I mean, I can actually think of times like where we disagree, and that's no problem. Like, that's stuff that we talk openly about or we work through. I mean, especially when it comes to, ears and some of the more advanced, like she has a lot of cochlear implant expert experience. I have said to her before, explain it like I'm 5.
Yeah.
And she's very sweet. She's very easy to work with. And like, she not only makes all the patient care better, but she makes like our office for all of us a much better place to work.
Yeah. I think recognizing that people bring in expertise from other things, even though you're like the expert, is very beneficial. A lot of our labor nurses take what's called spinning babies, that teaches nurses and like doulas and, birth workers how to position patients in different part of their labors to really like optimize having the baby come down. And I was not trained in this. I also don't spend that time in my patients' rooms though. And so really recognizing that they have an expertise in something that I don't, is only going to benefit the patient, because they're going to get to do what they're really good at. And then I get to come in and do what I'm really good at. And, once again, the only person who's going to benefit from that is the patient.
Exactly. But I do think that it's just good for doctors, especially I think like the next generation of physicians. Hopefully they're increasingly non-hierarchical, and so they don't need to be like really overtly taught these lessons, right? But it's like all these members of the team, what our speech language pathologists do, what our physical therapists do for my patients who need myofascial release of the larynx. I cannot tell you how many people I send over there. Like, These are super important therapies that no one can give but them. I mean, vestibular rehab, like we really do depend on these services, but I think that there's a way to approach those relationships that's going to be positive for all members involved and doesn't have to be, disparaging or traumatic for anyone.
Yeah. And I really do encourage trainees to really understand all the other people who can be helpful in your field. So, for any future OBGYNs, understanding what a pelvic floor physical therapist does. Those people are going to be helping you more than anyone that you could even think of, right? But you have to understand that they have an expertise in something that you are not trained in. But thank God for that, because now you have someone who can help your patients with things that you can't do or were not trained in. And so really taking advantage of learning what everyone else can do will also make you feel like you can offer something to patients that before you were like, I don't know how to help you with this. Like, just live with it. And like, that's not good. Like, we don't want patients to just live with their larynx spasming or them dealing with like pelvic floor dysfunction. Like, no, there's someone who's trained in this. Let's get you to them.
Absolutely. And I have to shout out, just earlier this season, we had Katie Booker, who is a pelvic floor physical therapist, come on. I learned a ton from her. And one thing that was more relevant to my practice directly is actually that she and I were just talking about, our patient populations. And I had never thought about this, but she said of my patients, who again, they all come to her for pelvic floor work, she said almost everyone anecdotally has TMJ.
Oh,
and I was like, but like we talked about it a little bit and I thought about it. It makes a lot of sense in terms of the tension that we carry pathologically. Certainly TMJ, it's all wound up in bruxism, teeth grinding, often worsened with stress, right? Like, so it was so cool, because probably 2 months ago, I would have been like, I don't know how much I have in common with a pelvic floor PT. Yeah. Open to learning.
Yeah.
I would love to learn from her.
For someone who's only above the clavicles, turns out there's still things below the clavicles that are affecting your part of your job.
I know, exactly. Yeah, which is so true. You're right. Like, that's why we need to be open to these things. And like you said at the beginning, of our conversation, we definitely keep learning after graduating from training, and like in our attending life, like there's a lot of rich learning to occur.
Absolutely.
How do you ensure personally in your practice then, with this type of a structure and like all the members of your team? I mean, you have residents as well, as you said. How do you get everyone on the same page when it comes to the patient's treatment plan at the end of the day?
I think that's just like working on your communication. We have a lot of structures in place at our hospital where we come together as team members to really review what the plan is and what, if there's patient preferences that we need to all be mindful of. If we need someone after delivery, they know that, we're already going to need them. I think, patient-centered huddles, those kind of things are always at least where I work, we have found ways to come together as a team to really be able to communicate what the patient is needing or desiring. And the more communication you have, really, the better.
That's great. I really love that. Before we wrap up here, do you have any advice for our listeners, especially those who are still in training, on how they can become their most effective educators and then collaborators in their future practice?
I think the big thing is thinking about, like, how do you want to be treated? How do you want someone to come to you and talk to you about maybe making a different plan than you initially came up with? And like, how do you learn to take all the medical speak that we have in our minds and putting it out the way that you are going to have your grandma understand it, right? And having to practice that day in and day out, you already do that in day-to-day life. And so it's really not hard for you to translate that into other ways of talking to people about medicine.
I love that. Dr. Fran, thank you so much for coming on here today. Where can our listeners find and connect with you online?
So you can find me at Paging Dr. Fran on TikTok, Instagram, and on Facebook.
Wonderful. And we'll have all those included in the show notes for you guys as well, if you want to look down there.
Awesome. Thank you so much.
Follow me on Instagram at francesmei.md and at Rethinking Residency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. I look forward to connecting with you on the next episode of Promising Young Surgeon. If you enjoyed today's discussion, please subscribe and leave us a review, and feel free to share with your colleagues as well. If you'd like to submit any questions for future episodes, email me at pys@heyinfluent.com.